Hello, I'm Dr. Brandt Gibson. I'm so excited to be back here today with you. Today, I want to talk about pressure ulcers. One of the common things that we see in the office as far as wounds are pressure sores or pressure ulcers. And they are basically wounds in an area of excessive pressure. These are most common, of course, in diabetics because of peripheral neuropathy where they lose the sensation in their feet. But it can happen on any individuals where they're sitting in an area for long periods of time. It is a concern for people that are in hospital beds or are always laying down in areas that, of course, I as a podiatrist don't treat. But we do see a lot of pressure ulcers or pressure sores in areas of callus, in areas of pressure from the shoes, and in areas, especially on the bottom of the foot or over bony prominences on the foot. Let me show you a little bit of an example here. This is just an image here, but one pressure spot, for example, could be right in this general area. As you look at that, you can see right there, there's a ulceration on the side of the foot because of a pressure sore there. You can also see common spots where you get pressure ulcers underneath the toes or underneath the ball of the foot, especially in these areas. You could also get pressure ulcers in the back of the heel, not showing here, but that is a location as well. Let me show you one picture. I apologize, this is a little bit more graphic than a lot of times we'll do here, but it'll help you understand kind of what they can look like when you get a pressure sore on the foot. You'll notice this pretty significant callus around the outside. There's almost like a punched out lesion where they just took the whole skin off and it goes down. You can get at the base of it, you can see that there's some red tissue. You got white areas where it's dead type tissue. You can actually get little injury areas as well. Sometimes when you get infections, you can actually get erythema or redness around it, swelling around it. You get pretty significant drainage sometimes from these as well. The whole point here is that you're getting these ulcers, these sores in that area, and it's causing the problem, causing the reason that you actually get the ulcerations there on the foot. So what do you do for it? I mean, if you have an ulcer on the foot, what should you do? The most important thing, of course, is to get the pressure off it. It's a pressure sore. More pressure keeps the wound progressing, can make it get worse. And so sometimes you'll be taken off the foot, so you're not walking on that spot. Sometimes you'll be put in a special boot or shoe designed to take the pressure off it. Sometimes it can be as simple as doing specialized inserts in the shoes that, again, take the pressure off that area or change the way the foot's functioning so it doesn't get pressure in that area. And in rare situations, you may have to go in and do surgical type treatments. If you have a foot deformity that's causing this huge bump or bone spurs or something like that, that could also cause the pressure sore, and it will need to be eliminated to really solve the problem. So decrease the pressure is the number one thing that you're going to do. Number two, you need to help work on it, get healed. That part of that is ensuring you have the appropriate circulation. If you have decreased blood flow, it's harder to heal. Number three, you want to treat any infections. If you can prevent infection, that's the best. But if you get an infection, you want to treat that infection, help manage it so that the infection is decreased. And by doing that, you can improve the overall function of that foot, the overall function of the healing process in that area so that ultimately it can heal. So you need blood flow, you need decrease in pressure, you need limiting the infection process and treating infections, and then a lot of times you may need certain types of wound care. So most of the time, it's going to be a good idea to go see someone that treats wounds, someone that can actually treat you, whether it's a wound care center or a doctor that actually commonly sees and treats these wounds, so you can get the help you need to get it healed as quick as possible. The longer the wound is there, the higher risk you have of further complications and further problems. So if you have pressure areas that are getting sore or pressure areas that are getting red and swollen, if you don't have normal feeling in your feet, it is worth being evaluated early to prevent these pressure sores. If you have a pressure sore, get seen, get this healed so it doesn't become a big problem in your life that can ultimately lead to losing toes, losing foot, losing leg, truthfully even losing your life if you're not careful. This is Dr. Brandt Gibson, and this is your Podiatry Tips Day 384. And the idea here is to help you understand pressure sores, pressure ulcers, and what you can do for them. Have a great day. If you'd like additional information, you can reach out to us at utahfootdoc.com. We'd love to see it. We'd love to help you. And ultimately, the goal would be to prevent these sores so that